Okay, so basically, this chapter is related to the vital sign, and we know what are the vital signs for the human. I mean, for us. First of all, blood pressure, then pulse rate, respiratory rate, right, and temperature. So this is the four most important vital sign. But also keep it mind, and also keep it mind in your system, the pain also the sign of vital sign. So we are actually going all of them. So vital sign most is some. So here some terminology related to the vital sign or blood pressure. So basically, I want to show you first. Okay, this one. This is the six vital sign. There are six vital sign. One is blood pressure, one is temperature, one is pulse, one is respiratory rate, and oxygen saturation. Oxygen saturation, right? And also the pain. So pain also important tools for as a vital sign here. So go back again. So first one is the blood pressure, right? So here is talking about some basic information about the vital sign. Okay, so terminology about the blood pressure. So everybody know what is systolic blood pressure. That the blood pressure is two. One is the systolic blood pressure, other is the diastolic blood pressure. Okay, so let me, someone is joining with us. Let me add that first. So, okay, so basically, you see, if I told you what are the normal blood pressure, you can tell, okay, normal average blood pressure is 120 over 80. So, two number, right? One is, I said, 120 over 80. So the first number is the systole, and second number is the diastolic blood pressure or diastole, right? So before to go systole or diastole, first of all, what is blood pressure? Easy. So blood pressure actually the pressure of the blood in the circulatory system. Pressure of the blood in the circulatory system, often measured for diagnostic since it is closely related to the force or rate of the heartbeat, right? And also we can say the diameter or elasticity of the arterial wall sometimes influence the blood pressure. Make it easy because the board exam do not ask you what is blood pressure, but for better understanding I'm just little bit discussing with you. Just imagine one tube, okay, I mean the water tube. In the water tube, water is passing by. So the water, what is put a
Can the
pressure on the
person mute your
wall
phone,
of the
please?
tube, this is actually the pressure. Same thing, blood is passing through the arterial system, right? An artery is look like the tube. The water is look, I mean the blood is like a water. So I said when water is passing by through the tube, right? So the water has a pressure on the wall of the tube. This is called pressure for the water. But same thing when blood is passing through the tube or arterial system, the blood has a pressure on the wall of the artery. This is actually the blood pressure. The definition usually they say the pressure by the blood when blood is passing through the arteries. This is blood pressure. Blood pressure is two types. One is systole, other is the diastole, or you can say systole or diastole. Okay, both is correct. So first of all, go through systolic pressure, measurement of the pressure exerted by the blood in the arteries while the heart is ventricles are contraction. So systolic blood pressure actually we can get when heart is contraction. Diastole you can get when heart is relaxed phase. The highest of the blood pressure, the top number of the blood. And diastolic blood pressure, the pressure of the blood is exerted by the blood on the artery wall when heart ventricle are not contracting, means resting phase or relax phase. So lower of the, the lower of two pressure, the bottom number is the diastolic, right? So I'm just going through something so it would be easy for us to understand. Suppose 120, you can see also an 80, right? This 120 is the systolic and this 80 is the diastolic, right? So now I'm writing something different. The PATIA, patient number 1, okay, whose blood pressure is 195 over 80. Patient number 2, blood pressure is 200 over 110. Another patient is patient number 3. Blood pressure is 110 over 145. So you can see I'm just writing 3 type of patient here, right? 3 type of patient. The patient 1, the systolic blood pressure is 195 and diastolic is 80. So this diastole is normal, but systole is not normal, right? He is hypertensive, right? But systole is more. Patient number 2, systole and diastole both are higher or more than the normal, right? He also hypertensive. Another patient here, the patient number 3, systole is normal, but diastole is more, right? He also hypertensive, right? So this is different type of patient. It is not true every patient should become in the same sign on symptom or increase the same one. I said in systole or diastole, if any one is increased, other is normal, they are hypertensive. If both systole and diastole both is increased, also they are hypertensive. If systole is normal but diastole is more, they also hypertensive. You understand? So I said this is 3 type of patient, but as both are hypertension, they give them they need the antihypertensive medication. Now go second one. Same thing here. Hypertensive means the systolic blood pressure is constantly over 140 of mercury and diastole constantly over 90 millimeter of mercury, right? Constantly, they say. And hypo, blood pressure suddenly fall 20 millimeter of mercury to 30 millimeter below the patient's normal blood pressure, or fall below the normal 90 to 60 millimeters. So both are, we can say, both are causes the hypertension here. So let me see some, open something for you. So it would be helpful for understanding. So I think it is here. Okay, so basically, here, so more terminology related to abnormal blood pressure, right? One is called orthostatic hypotension or postural hypotension. So orthostatic hypotension means patient blood pressure is changed during when they change their posture. Like a patient in the sitting position, suddenly they stand up and blood pressure drop. Another patient is lying down, but suddenly stand up or sitting from the lying position, blood pressure is drop. This is called orthostatic. Ortho means position change, hypertension. So hypotension, and there are both orthostatic hypotension or postural hypotension. This is two names. When the position change, the result in a systolic pressure drop 10 to 25 millimeter of mercury. So this is the unit, millimeter of mercury, or the diastolic pressure fall 10 millimeter of mercury. So unit is millimeter of mercury. Keep it in mind. Most important. And also board, especially the NCLEX, LPN or RN board asks this type of question. What are the pulse pressure? What are the pulse pressure? You can see the pulse pressure. Pulse pressure basically the pressure difference in between systole and diastole. So here, okay, just wait. Somebody told me she doesn't hear me. Someone phone need to be mute. Okay. So
teacher, can you mute?
I wrote it. I got a text message from one of your friends. She told she does not hear me. So if you do not hear me, please raise your voice. Otherwise, I am going to confusion. And she also wrote, someone phone need to be muted. And to be muted, I believe only Mimi, your phone is not mute. You should mute your phone, Mimi. Okay, so, and okay, so let me increase the volume a little bit. Hope you can hear me now. Okay, so basically the pulse pressure means in let me take your percentage for today. Okay, so as the pressure, the difference, the measurement of the difference between systolic and diastolic, this is called pulse pressure. So as an example, if I go here, the patient's systole is 195 and diastole is 80. What are the difference between these two, systole and diastole? This is pulse pressure. Patient number uh, 2 or 3. So same thing, number 2, what are the difference between 200 to 110? So it is the almost 90. So 90 is the pulse pressure. So what are the difference between systole and diastole? This is called the pulse pressure. Very important. It is easy, I know, but don't neglect it. Otherwise, you will miss the score in the board exam. And here some of the situations, so some of the situation when the blood, okay, so we're just going to talk about the body temperature, right? So terminology related to body temperature, right? But keep it, something is important before to go the temperature about the blood pressure. I want to say, in some situation in the body, the blood pressure is changed, right? Like I said, if a patient is infected, infection, that times blood pressure is normal. Blood pressure not change. But if a patient is go hypovolemia, mean when blood volume is go down, right, or fluid loss, that times blood pressure drop. Same when blood glucose level drop in the patient for diabetic, blood pressure sometimes normal, sometimes increase. In other situation, like when blood pressure go up, like diabetic patient, or if the patient who take the narcotic like morphine, pethidine, meperidine, their blood pressure go drop, right? Other situation, if anybody has anxiety or pain, suddenly pain start, any other cause, when pain start, you should go for the anxiety. So definitely, if suddenly you have a pain in the abdomen, you thought, oh my god, what is happening with me in my abs or my head, and you will be get anxiety, panic. So when patient is panic or anxiety or pain, blood pressure go up. Same thing in acute MI, myocardial infarction, blood pressure go down. Suppose a patient is doing some exercise, blood pressure go up. A patient, it is, I'm talking about that sometime in some situation, blood pressure go up. Okay. And here some terminology related to the body temperature right now. So when anybody's temperature is up, we call the febrile situation, febrile, right? Febrile means fever, but afebrile, I said several times, when any term is started by A, right, means A means absent. A stand for absent, right? So absence fever, like amenorrhea, absent menstruation, right? Like I said, afebrile, no fever, without fever. Anemia means hemoglobin is absent or less, anemia. Aplastic anemia means bone marrow is less. So A means absence, easy to remember. A stands for absence. Febrile. Hypothermia, hyper is always more feverish. Hypo means temperature below the normal, right? Same different words called pyrexia. Pyrexia means hyperthermia. Pyrexia, patient has a fever commonly above 100.5 degree. So we said hyperpyrexia. Go next here. So basically, terminology related to the normal pulses. So this is talk about the basic temperature, right? So normally, yeah, you have to know what are the normal temperature for the normal individual, right? And same thing for if it is better if we know all normal range. Now go talking about the uh, pulse, right? Apical pulse they talk about. So apical pulse, easy to remember the pulse what we got over the heart, right? Where heart is located, it is fifth intercostal space, left side, or just below the nipple, right? It's called apical pulse. But when we get the pulse in a radial artery in the wrist joint, this is radial pulse. So something is related to the pulse is called S1 and S2. Heart is produce the two sound. One is called S1, other is called S2. Is the two way lap tap lap tap. So S1 and S2 produce during the closure of valves. So inside the heart, there are four set of valves is there, right? Or here, so S1 is produced during tricuspid and bicuspid valves closing. When tricuspid and bicuspid valve is closed, right? Tri means three cups, bi means two cups. So when this two is closed, S1 is produced. And S2 is produced when pulmonary and aortic valve is closed. So this is two valves. Board asks this question: S2 produced when? S1 produced what time? Right? S2 is produced during pulmonary and aortic valves closing. But S1 is produced when tricuspid and bicuspid valve is closing. So these 2 points we have to know for the exam. For exam, I said, don't miss it. S1 tri and bi, S2 pulmonary and aortic. Frequently asked. So you should try to how to hook up inside your brain. S1 tri bi. 1, 2, 3. Bi means 2, tri means 3. It is S1. 1, 2, 3. Easy to remember. S2 pulmonary. If you know one, another one automatically you can remember. 1, 2, 3 is together. 1, 2, 3, 1, 2, 3, right? So S1 is produced when bi and tricuspid valve closing. S2 produce pulmonary and aortic valve closing. Other name of aortic valve is called semilunar. Lunar means moon, right? And sometimes you can say the not in the sky. Sometimes it look like full moon. Sometimes half of the moon. When it is half moon, it's called semi-lunar or semi-lunar, whatever. So the aortic valve is look like half moon or semi-lunar moon. Okay, so other here it is important to remember, very important for board exam. And go next here, some terminology related to the abnormal pulses, right? Abnormal pulse related. So now we're talking about the pulses. Okay, so to the abnormal pulse, bradycardia, tachycardia, and pulse deficit. Pulse deficit. Bradycardia. So bradycardia means heart rate below the norm, 60 beat per minute. Everybody know that. I appreciate it. And tachycardia means when heart rate more than normal. We are talking about the heart rate right now, right? So keep it in mind the heart rate, right? If a patient is infected, heart rate go up, means tachycardia. If a patient suddenly hypovolemic, blood pressure, sorry, heart rate go up, right? If a patient is diabetic, I mean blood sugar is go up, blood pressure go up. If a patient is anxiety, pulse go up, right? Heart rate or pulse go up. If a patient is the pain, pulse or heart rate go up. So I'm saying infection, if patient is hypovolemia, I mean shock. If patient diabetic or high blood sugar, all of the situation about or anxiety or pain, all of the situation, heart rate or pulse rate going up. But if a patient take the morphine, pethidine, or narcotic, blood pressure go down or pulse go down, heart rate go down. Same about the MI, myocardial infarction, heart rate or pulse rate go down. I'm sharing this is sometime you should know it. You should know for the exam. Also, you are a medic person, medical healthcare provider. You should know. And what are the difference between the apicals and radial? This is called pulse deficit, right? It is called pulse deficit. So, what is pulse deficit? Difference between apical and radial. So what is apical pulse? The pulse get over the heart, right? The pulse get over the heart. This is called radial. Sorry, apical. Radial pulse means the pulse get over the radial artery. Same thing if you measure your heart rate or pulse rate over your heart in the fifth intercostal space, right? You're supposed to get 110 beat. But when you same patient, you get the pulse rate in the radial artery, you should get 100, not 110. So what are the difference between 110 and 110? This 10 is called pulse deficit. The difference between apical and radial pulse. When the radial pulse is lower than the apical pulse also. Here, usually it should be lower than the apical pulse, or apical pulse is more. Something is important when you check the infant, count the radial pulse or apical pulse, you have to measure full minute. But you, some of you already work as a LPN in the hospital. If I tell you, can you count the pulse of the patient? What you do, you have to count 30 minutes, second. After 30 seconds, what did they get? You have to multiply by 2, right? But we should collect, count the pulse full minute, full minute. So board asks this question, okay? How long you should count the pulse for any patient? What you do in the hospital, don't think about this. You keep it in mind. Answer should be full minute means 60 seconds. Easy question, but board asks this question. And then go for the next. So here, some term for normal respiration. So normal respiration is called eupnea, normal respiratory rate. Normal respiratory rate is called eupnea, right? But again, Eupnea, I said eupnea means when normal respiration rate is 12 to 20 beat per minute. But keep in mind, some books say 16 to 24. Both is correct. And the board, if you give one, they will not give these two together. They give any one. 20 to, so 12 to 20, or some books say 16 to 20, or some books say 15 to 24. All is correct. And I said the board exam usually will not give you that conflict type of question. They give only once. If they give 20 to 20, 12 to 20, they will not give you the 16 to 20. They should give you 35 to 65. They should give 5 to 10, right? So we will not miss anything, hope so. And also Mary, you someone is talking here. Okay, so here usually it's called eupnea, normal respiratory rate. Then go for the next, it is called abnormal, right? Abnormal respiratory rate, it is from here. Abnormal respiratory rate, right? One is called apnea. I said A stands for absence, right? Apnea means respiratory rate is absence. But more accurately, when respiration ceases or stop, okay, no more, absence is called apnea. Okay, so same thing, bradypnea, trachypnea. Keep in mind, also bradycardia means heart rate less. Tachycardia means heart rate, but trachypnea means pulse rate. So, oh sorry, respiratory rate. Don't miss it. Bradypnea, bradycardia. Tachypnea, tachycardia. It is different. So bradypnea means respiratory rate below 12 per minute, and trachypnea means respiratory rate above that 20 minutes per minute. Here and here, so bradycardia, trachypnea, and also the dyspnea means lobulator or difficulty of breathing. So when difficulty of breathing is called dyspnea, right? So keep in mind here, respiratory rate, same, if a patient is infection or if a patient is shock, means hypovolemia or shock, or if the blood sugar level is going up in diabetic patient, or a patient is anxiety or pain or myocardial infection, all of the situation, the heart respiratory rate going up. I again repeat it. So when a patient has an infection, right, and when a patient has a gut infection, they have also the fever. So infection, fever, or when a patient go for the shock or hypovolemia, or if a patient go increase the blood sugar level like diabetic, or a patient is anxiety, or a patient has a pain, or a patient has a myocardial infarction, even a exercise, when anybody do the exercise, all of the situation, heart rate is going up, means they have a trachypnea. So basically, I said, again, I recap it, during infection, during the shock, during uncontrolled diabetic mellitus or anxiety or pain or myocardial infection or exercise, all of the situation, pulse respiratory rate is go up, and this is called tachycardia. In some situation, the heart rate or pulse rate or respiratory rate is going down. This is the example of when anybody take the narcotic. Narcotic means pain medication or opioid, morphine, pethidine, meperidine. That times your temperature go down, heart rate go down, respiratory rate go down, even blood pressure go down. So why I'm talking about all of this? Because this is important for us. So tachycardia, bradycardia, dyspnea. Go next. And here abnormalities of respiratory term, hypoxemia, hypoxia. So hypoxemia, right? Mia, and this is called hypoxia. So two different terminology here. So one is hypoxemia means decrease the oxygen in the blood. When it the blood, this is called hypoxemia. But hypoxia, when they reduce in the tissue, right? When they reduce in the tissue, this is called hypoxia. This is hypoxemia, hypoxia. And orthopnea means difficulty of breathing unless in upright position. And second is called stridor. Stridor means abnormal sound produced over the trachea or tributaries of respiratory system. Again, in our Google Classroom respiratory system, there are some very short, like 20-second or 10-second videos I left there. All of the sound, S1, S2, then stridor, wheezing, bronchi. This is really important for our board exam. Okay, you have to listen this video because sometime NCLEX board give the video like this. You have to hear, then you have to find out what for what. It is not so hard, very easy, but you have to listen with your hearing system. No, we have to listen with your heart. When you listen with your heart, you will not forget it. And I do not know how I can make you understand how listen by the heart. You should feel it. You have to realize it. Okay, not only hearing. Then you will not forget. Orthopnea and stridor means audible, high-pitched sound that result from partial obstruction of airway. So this is called stridor. And this now they actually talk about the 6 vital sign. We talk about the blood pressure, we talk about little bit temperature, we talk about the pulse, respiratory rate, and now going these two. And here the significant of 5 objective of vital sign, objectives. Okay, so first of all, reveal mean how certain systems are functioning. So if when you go and check the simple vital sign, you can find out your patient is stable or unstable, right? It's simple. So I said, if the vital sign is not within the normal, they're unstable patient. When you find out the patient is unstable, you have to assign the your staff who take care for whom. The patient whose vital sign is normal, you can assign the LPN for take care of them. But the patient who is unstable, you should take care by yourself, or you can assign for the RN to take care of them, right? So delegation is important. So just observing the vital sign, then you have to delegate the RN or LPN for them. Second point, if a patient is unstable, right, vital sign is not normal, you have to give them priority. So prioritization also depends on this. So we are RN, and definitely we will get so many prioritization question in the board exam. So only simply check the vital sign. You have to give the, I mean, you have to give the scope to check them first, right? Prioritization also important. Delegation is important here. And also say provide the data regarding the patient overall condition. If a patient is got hospitalized, then you check, and after your treatment plan intervention, after 2 days you check the vital sign, and vital sign is stable, mean your patient condition is improving. So simply vital sign also help you to evaluate your patient, and evaluate is the process of nursing diagnosis. So also help to diagnose the patient, right? You can prepare, them should go and discharge from the hospital. If a patient got hospitalized and vitals after 2 days interval, you saw the vital sign is not stable, then you have to notify the healthcare provider. They have to change the treatment option. They have to change the caring option. So it is also help you for diagnosis, for changing the intervention, also the help to outcome. And you see, everything's actually the nursing process: diagnosis, intervention, planning, outcome, right? Also provide the baseline again, which subtitle change can be measured here. And now go for here the body temperature. Body temperature is measured either Fahrenheit or Celsius. Fahrenheit or Celsius, they say. So factor affecting the temperature. So what are the defined factor change or influence the body temperature of the patient? First of all, environment. So if you see it, okay, one of the students, she is sounding people are talking beside of her. I can check. I can see her name. But still she is talking. Okay, so environment and environmental factor, time of the day. So basically environment. So if you are sitting in a cold room, okay, or cold temperature, your blood pressure go down. If you sit in a under the sun, or if you sit in a hot room, blood pressure should be go up. And also the time of the day. So morning temperature, evening temperature, or night temperature is not same, right? Just at the early morning, you got up from the sleep, your temperatures go up. So the day variation is also very important in the blood pressure, I mean temperature. Physical activities. So if you do physical activities, sedentary work, physical exercise, your body temperature should be go up. And some medication, I told, narcotic, right? Narcotic or opioid, morphine, meperidine, pethidine, cocaine, all reduce the temperature. Some food or drink. So if you take hot coffee, after hot coffee, the healthcare provider measure the temperature from your oral cavity, it should be go up. Smoking increase the temperature, or some illness definitely increase the temperature. Here, now go next. They said some route used for taking the temperature. So first of all, oral temperature. We put the thermometer inside the oral cavity. So oral more accurate, most common route uses, right? Most common and more accurate, not most accurate, more accurate it is. Then tympanic. Sometimes we use the tympanic membrane in the ear to measure the temperature. Axilla, sometimes used, but in axilla 1 degree Fahrenheit lower than the oral, so it is lower. Sometimes we use the skin, our body skin to check the temperature, or temporal artery. Temporal artery actually behind the ear lobule or ear auricle. So this temporal artery we use to measure temperature. Or rectal. Rectal is the most accurate. You see, most accurate here. And also closer to the core temperature. So what are the real temperature in the body? It is almost close and 1 degree Fahrenheit higher than oral, but the axilla lower. But keep in mind, rectal temperature, it is very weird, right? It is not feeling good to take the temperature rectally. So this is the reason we have to avoid. And also, if a patient has a diarrhea, definitely it is not a good choice to check the blood temperature in the rectum. Also keep in mind, if your patient is unconscious, don't go to check the temperature in the oral cavity, right? Very important information for exam. Diarrhea, not for the rectal. Unconscious patient, not for the oral cavity, right? Don't neglect, important. And factor to assess the regarding the respiratory rate. So what are the factor? We have to assess regarding respiratory rate. So what are the things we have to check? First of all, rate per minute. Like we said last time, 12 to 20, right, per minute. So this is the rate. This is called rate. One. Depth, right? What are the depth? So when you feel, when you take the respiration by stethoscope, or you can check, you have to realize the depth. It is too deep or shallow, like this. Then rhythm. So every respiratory rate, inspiration or expiration, has a same interval, right? When it's same interval and rhythm is normal, or rhythm is smooth, right? We can say the rhythm is regular. Pattern, is it deep or it is shallow? It is intermittent or not? And also the respiratory effort. So major muscle we use for the respiration is called sternocleidomastoid muscle in the neck, and also diaphragm. So diaphragm mostly help for the respiratory system, inspiration or expiration. If I use my accessories muscle for the respiration, like sternocleidomastoid muscle or intercostal muscle. Intercostal muscle means the muscle in between the ribs. Intercostal. Other term of the ribs is called costal, right? Intercostal. So basically, in a healthy individual, do not use the intercostal muscle for respiration, or sternocleidomastoid muscle for the respiration. But if your patient has asthma or COPD, bronchitis, respiratory problem, they use the accessory muscle. And when you check them, you can see this patient has a shortness of breath or difficulty of breath. They're trying to compensate, and you can see his neck side muscle is up and down, increasing, right, or movement during the respiration. This makes people is frightening. Same thing if they remove their cloth. Definitely when you go to check your patient, you have to expose them under a good light, never abuse them, right? So you can see his muscle is okay or not okay, using during the respiration or not, or yes. So respiratory effort also visible. So now abnormal breath sound. So abnormal breath sound. One of the sound is called wheezing. One is called crackles or relay, ronchi, stridor. So I told you in the Google Classroom we have a very short videos there, so we can listen from the video from the Google Classroom, because it is difficult for you to make you understand what is wheezing, how it look like, or crackles and ronchi and stridors. But stridor we can go basically over the trachea. If the patient has any kind of vocal cord carcinoma or vocal cord problem, we can get the stridor. If your patient has a asthma or COPD, you can get wheezing. If your patient has a pulmonary embolism, right, or effusion, or if you can get the crackles or ronchi. And now go next is called oxygen concentration. Oxygen concentration, very important for board exam. Basically, concentration we SpO2, saturation pressure of oxygen, saturated pressure on oxygen here. So let me check the percentage of you again from here. Okay. So so saturation rate, right? So saturation rate of oxygen normal. It is normal 96 to 100. Very important for board exam. Very important for board exam. If you can see, in especially the prioritization question, the out of 4, if you get any patient, okay, saturation of oxygen is less than 96, you have to give them the priority. That's it. A 4 patient is waiting to check for RN. Which patient you go first? If you see the saturation rate is 96 to 100, you do not need to give the focus. But if you see the saturation rate is 90, 89, okay, 91, you have to go and check this first. And this is the answer of the question. But keep in mind something really important for now, okay, and board exam. If the question mentioning like this, a patient has a history of asthma or has a history of lung disease, has a history of COPD, okay, and saturation oxygen concentration or saturation rate of patient is 91%, you do not need to give the priority. This is normal for them. Okay, if you really understand this one or can read it, if you can make the correct answer. I'm repeat it. Normal saturation of oxygen is 96 to 100%. The board asked the question 2 category. One category, they said, out of 4 patients, which patient you have to go first? Out of 4, if anything related to the saturation of oxygen and the saturation of oxygen rate is less than 96%, like 91, 92, 89, we have to go and check this patient first. And this is the answer of prioritization question. This is one category. another question can possible to come. But before to go this question, I want to say something. Okay, the normal healthy human being who do not have any kind of lungs disease or respiratory disease, their oxygen situation or oxygen concentration should be 96 to 100. Now, second point, if any person has a history of lungs disease, right, history of respiratory disease, their normal situation rate is 90%, 90 to 100%. So when you go in the board question, carefully read the question. Is it normal healthy individual or is it already the respiratory problem patient? If the question come like this, a patient has a respiratory bronchial asthma, okay, and respiratory and saturation of oxygen is 91%, mean it is normal for them. Okay, I'm going the second next. Also, the clip sensor. Clip sensor means the sensor you usually see in the hospital. What the doctor office, if you go, they put in our tip of the nail, okay, or fingertip. It is called sensor. So clip sensor can be applied to the fingertip or earlobe or bridge of the nose or toes if circulation to the feet is adequate, right? Okay, so go next. This is called the when access the vital sign, when we have to go, for what time we have to check it. We have to check during the admission of the hospital, during the admission, or each visit to a clinic or emergency room. So when anybody first time go for the hospital for admission, the LPN or RN have to take the vital sign. Or anytime or every time the visit of the clinic or emergency room or each home health or hospital visit, they has to check it every 8 hours. When the patient is hospitalized already, every shift we have to check it, or we have to follow according to the hospital policy or according to the physician order. Even a patient complain, suddenly a patient said, I'm feeling I'm going to die, please check my blood pressure. Then you have to check, okay? And also when you suspect something is changed in the condition of the patient, right? Patient is suddenly going to unconscious or semi-conscious. You have to check the vital sign. Is it normal or not normal? Even when you're ready to make a phone call to the healthcare provider regarding your patient, better you have to check the vital sign because anytime they can ask about this. And now go continuation. When administering the medication, suppose you are going to give a medication to the patient, better to check the vital sign before to, and before, during, or after the blood product transmission, we also check the vital sign. And before, during, or after surgical or diagnostic procedure, actually this simple checking the vital sign save your patient life, right? Every 4 hours when one or more vital sign are abnormal. So if your patient vital sign is not stable, right, unstable patient, every 4 hours we have to check. And no, go next here when access the vital, and they said a second time when the measuring assessment findings is different from the first assessment, right? We have to check every 5 to 15 minutes if condition is unstable. Yes, as usual, I'm sure it is very easy to understand. So when the reassess the vital sign, what are the unstable condition? We have to reassess the vital sign. So reassess vital sign after the administration of IV medication, intravenous. Also changing in level of consciousness. If your patient is semi-conscious to unconscious totally, right? So we have to check. Unstable post-operative. So post-operative patient is very unstable. We have to monitor. Uncontrolled bleeding because patient has a chance to go for the shock, right? To prevent the shock, we have to check blood pressure especially and vital sign. If patient is pale, cold, or clammy skin, actually it is the sign of hypovolemic shock, right? If hypovolemic shock patient like this, pale, cold, or clammy, means they are unstable. We have to check vital sign. Whenever you detect or suspect a change in the patient condition, or whenever a serious condition is suspected, if you feel your patient is something is massively changed, we have to check it. And whenever you instruct to say to reassess, yes, it is. If you feel to reassess, we can do it anytime, right? And nobody can stop it, and it is not a bad thing. Just you checking your patient, what are the condition of them. So some guideline. So guideline for assessing the vital sign, some guideline here. So basically the guideline for assessing vital sign, so use an organized or systemic approach. Organized and systemic approach. Use to appropriate equipment for each patient. Be familiar with the normal range for different age group, right? Also compare the vital sign with previous vital sign range for specific patients, and also knowing the patient medical history, what medication they take, and also therapy. So what does it mean? Use the organized and systemic approach. Means you have to check the vital sign very systemic and organized way. What does it mean? I said, like non-invasive technique, you have to check first. Then you have to go least invasive technique. Like out of 5 or 4 vital sign, you have to check the respiratory rate first because this is less invasive. Then you have to go for pulse count. It is least invasive. You have to touch the patient radial artery. Then you have to go and check the temperature. It is least invasive. You have to check and touch your patient. And finally, you have to go and check the pulse rate because it's the most invasive. What does it mean, most invasive? Because you have to put the blood pressure cuff in the patient forearm. You have to put the stethoscope, their cubital fossa in the hand. Also, you have to touch their pulse, right? And stethoscope as well. So this is some technique of equipment you are using, the technique. So this is called organized and one by one procedure and check it. Especially the children, if you check first the blood pressure, they thought you are going to tie up them with the chair, right? And they thought anxiety and panic. And if the anxiety and panic, you will not get an accurate number. Same thing, if the patient is go panic, after that you go to check the respiratory rate, you will not get a good good experience to get it because they're already panic. So better to go less invasive or least invasive technique first, or non-invasive technique first, then go for the invasive technique. Okay, so also they said that compare the vital sign, what you got the previous patient is going to improve or deteriorate, you have to go for inform the healthcare provider. So next here, guideline continuation, understand or interpret the vital sign findings. If any kind of abnormalities, we have to interpret them. We have to read it, then inform healthcare provider. And record and communicate the significant vital sign change to the physician or the next shift your coworker. Minimize the environmental effect when you check the vital sign. Very important. A quiet and good setting, good environment is very important during the check it. And also four circulatory qualities. So go next. Here, four circulatory qualities means strength of the heart contraction or pumping action, blood viscosity, blood volume, and peripheral resistance. So this is the four factor is influencing the patient blood pressure. If imagine my heart does not contraction well, if my blood does not contraction well, I will not get the accurate heart rate or pulse rate. So pumping action of the heart is very important. Imagine a patient has an anemia, right? Or heart failure. Heart is failed to pumping the heart blood to the body. When heart is failed to pumping, definitely will not get accurate number. Blood viscosity. If my blood do not have enough nutrient like iron or other nutrient, means viscosity is not enough. Viscosity means density, easy way to remember, or thickening of the blood. So blood has a good thickness, means blood has a good nutrition, blood has a good electrolyte, blood has a good oxygen, means viscosity is good. When blood has a viscosity or thickness is good, we have to get the accurate measure. Also, blood volume. Volume means total amount of the fluid inside the blood, because blood is contain the water and blood cell element, right? List RBC, WBC, or micronutrient. It is mixture of the blood, and they contribute to the volume. So if I have a blood loss, right? When blood loss means blood volume is dropped. When volume is dropped, blood pressure drop, and patient is hypotension. Peripheral vascular resistance or elastic recall ability of blood vessels. So peripheral, suppose a patient has a Barger disease, right? Or Raynaud phenomenon. So if my artery or peripheral system is not good, the peripheral resistance should be increased and blood pressure should be up. So this type of peripheral resistance in atherosclerotic or arteriosclerosis also important for the resistant. Here, this is called Korotkov sound. So what is Korotkov sound? The sound produced during the measurement of the blood. So I am not sure if you work in the hospital, some of the hospital has a manually have to check the blood pressure, and some of the hospital has a device to check. If you check manually the blood pressure anytime in your life, when you put the stethoscope in your ear and you put the cuff in the patient hand and you pumping the hand pump and it is inflecting the cuff, and when you inflecting and pumping over the meter, blood pressure meter, or sphygmomanometer, this should be go up, up, up. When it go up, after the certain time, and you stop the regulator, and the meter should be go down. When they go down, same time you can hear a sound, right? When you listening beat, and after certain time beat should be disappear. Sound is come and sound is disappear. When sound come first, This is the systole. When sound go disappear, this is a diastole. The sound in between systole and diastole you hear over the stethoscope, this is called Korotkov sound. That's it. No need anything more. So if you do not understand, when you come in our simulation lab, I will show you what is Korotkov sound. That's it from here. I will show in our laboratory, I mean simulation lab or in the hospital when you go for the clinical. Korotkov sound. No, go next. This is called the factor affecting the blood pressure, pulse, rate, and respiration. So I'm going to little bit faster right now to finish the PowerPoint. So factor, and if you do not understand, just stop me. I will explain more. So factor affecting the blood pressure, pulse rate, and respiration. First of all is race, obesity, right? So basically, the heart rate is more in infant rather than the adult, right? Same thing, the influence of these three, who is a obese person. After exercise or rest, exercise all should be go up. During the resting phase, this should be go down. And also the anxiety, all of this increase during the anxiety or during the pain. Some medication, I said narcotic, reduce the blood pressure, reduce the pulse rate, reduce the respiratory rate. Narcotic or caffeine increase all of them. Hemorrhage decrease all of them. Increased intracranial pressure. Increased intracranial pressure basically increase the blood pressure, increase the temperature, but increase intracranial pressure reduce the heart rate and pulse rate. So it is important during the intracranial pressure to increase, to reduce. Blood pressure increase, temperature increase, but other two means heart rate and respiratory rate reduce. It is important for board exam. Okay, so go next. Let me take our percentage again. I'm taking several times because some of this come and go. So I want to make sure all of us here. Okay, and I'm taking because we have to take the record. It is. Okay, so go next. The effect of hypertension on the body. Effect. So gradual loss of elasticity in the arterial wall result in the less strength or recall, and also heart has to work harder to pump the blood through the circulatory system. So when in case of any kind of disease like MI, right, or any other or atherosclerotic change, our heart is trying to pumping, right? Heart is trying to pump, but the body structure not allowed to do this, but heart is continue to work. And this is the reason being the result, heart is failed, heart failure occur. But I said heart is worked so hard to pumping the blood throughout the body, right, or circulatory system. The effect of hypertension in the body and heart fail finally. And what are the risk factors for hypertension? One is the family history, smoking, then chronically high stress, moderate to heavy alcohol consumption, obesity, and also elevated the cholesterol level. So family history is most important for the hypertension. Family history, it is called non-modifying factor, right? If my father has hypertension, my uncle has a hypertension, it should be transmitted to my body, right? Family history is positive. I do not change my gene. It is transmitted through the gene and is called the non-modifying factor. Smoking. Smoking, if I want, I can stop the smoking, So it is called modifying factor. Genetic or family is non-modifying, but smoking is a modifying. Also stress basically kill our life. Stress is a silent killer. They causes the diabetics, they causes the blood pressure, and also other disease. It is they eat our heart, they lick our brain, right? They bite our whole system. Moderate to heavy alcohol consumption causes the hypertension. Obese person has only one problem, heart disease, hypertension. If your cholesterol is constantly high and you are not taking the statin or levostatin or simvastatin, right? It should continue, your heart is going to down and hypertension is result. And damage the cause of untreated hypertension, damage causes by untreated brain damage, heart damage, or congestive heart failure occur. Kidney is going down, kidney function is failed, and also they have a bad effect in retina of the eye, and patient lost the vision. And now go to second here, peripheral pulse site, where we have to check the pulse in the body. Okay, where? First of all, temporal artery. Temporal, used when radial is not accessed. Suppose my both hand is broken, wrist is broken, because patient is come from the any kind of road traffic accident. That times we have to check other side of the body. One is called temporal artery, carotid. Carotid artery we use in the neck side. Brachial, usually you use for the measurement the blood pressure on the cubital fossa. Radial, use the pulse rate. Usually we use the radial arteries. And femoral canal, it is just beside the groin, determine the leg circulation. Popliteal, determine the leg circulation. Popliteal, usually inside the popliteal fossa. Posterior tibialis, determine the foot circulation. For peripheral resistance, or dorsalis pedis, determine the foot circulation. And here the peripheral pulse assessment. First of all, when we go to assess the pulse, we have to check the strength, right? And also the equality. Equal, is it equal in the both sides? Is it symmetrical or asymmetrical? If I check my left leg pulse, same time you have to compare and contrast my right side. Weaker than opposite side, then you can say yes, this side is okay, other side is not okay. Is it symmetrical or asymmetrical? So now go some regulation of vital sign. Vital sign definitely regulated by the brain, especially the medulla, pons, and hypothalamus. Hypothalamus, this is important for board exam. Hypothalamus has a thermoregulator. So temperature is regulated by hypothalamus. This is important for board exam. Then go the next one here. Oh, what happened? Okay, so this one, the characteristics of pain to be assessed. So when we go to assess the pain, we have to check some characteristics of pain. One is where the pain, right? When a patient is come to you and they said, I have a pain, you tell them, can you locate the pain by one finger? So they can locate it here. Is it epigastric? Is it left side of the chest? Is it shoulder? So site of the pain is very important. After the site of the pain, you have to ask is what direction pain is go. I mean the direction of the pain. Characteristics of the pain. Is it constant pain? or pain come and go, intermittent pain? Is it sharp? Is it sharp? Or is it dull, aching pain? Or is it like the stabbing pain, like stab someone? Is it aching pain, like cramping pain, right? Come and go, or burning sensation of pain? So when a patient complains of pain, we have to try to find out what are the nature of pain, what are the location of the pain, okay? The direction of migration of the pain, and also severity of pain. Is it mild? Is it moderate, or is it severe? Severity of pain, usually a pain scale we use for hospital, right? And also a special scale we use for the children or special need. So this is the question board asks, and if you go in our center book, they have a 2 or 3 question, and also the evolve question, you have to go and check it. Vital sign, after that we have to write and documentation each vital sign. This is the way, and I'm going to give this PowerPoint also, but you also able to get in the Google Classroom, but I will send it to you by email. So when you write the vital sign, way of documentation like this: blood pressure 130, 4/78, systole, diastole. Temperature, this is the way we should write, okay? I'm not going through each and everything, it is not so hard. And now go for the here, the pulses. The pulse 64, it is regular, and strength is 1 plus. Respiration rate is 50, and rhythm is regular, right? Oxygen saturation 96%. Pain, no pain, or deny the pain. Also, this is some example we left there, how we have to write in hospital like this: BP 120/66, temperature 97.6 degree Fahrenheit, pulse 70 beat, regular 1 plus strength, respiratory 70 and regular even, saturation oxygen 98%, okay, at room temperature. Also, in the some clinical questions, especially in the RN, they have to write it like this. Then you have to find out which one is the abnormal and then give the focus on it. Same chart, maybe we can write down like this, okay? Same thing, blood pressure 120/60, temperature is 97.6 Fahrenheit, pulse is 70 beat per minute, respiratory is 70, and saturation 91%. So if you do not know what are the normal, it should be hard for you to find out the abnormal. And NCLEX board exam do not give the normal range. I said I went there, okay? And also, but the USMLE, I mean MD exam, they give the normal in on B side of their question. Okay, so next here, health condition affecting the vital sign. What are the health condition affect the vital sign? Very easy. Let me read it at least one time, then we finish. Hypertension alter the vital sign. Atherosclerosis alter the vital sign. Congestive heart failure alter the vital sign. Hemorrhage, shock, infections, COPD. All the time when I went through, I told you like infection increase the temperature, increase the heart rate, increase the respiratory rate. Like shock decrease the temperature, increase the heart rate, increase the respiratory rate, right? So all of this condition affect the vital sign. Possible intervention, so when we have to go and intervene the patient, possible intervention for when elevate the temperature, we have to take some measurement to reduce the temperature, because temperature is bad for your brain. Also, newly identify the rebound pulse or elevated blood pressure. So if suddenly elevated the blood pressure or rebound pulse, we have to take to measurement for the patient, give some antihypertensive medication. also slowing the pulse and rising the blood pressure in a patient with a head injury. So if the patient is increase the intracranial pressure, so their blood pressure is going up. So it indicate patient pressure or intracranial pressure is going up. Vital signs that are significantly different the last reading. So suppose in the morning you check the vital sign, but at the evening hugely change, hyper or hypo. You have to think about this because it's the emergency. And this is the last page for today. And here they said when we have to take the history from the patient, right? Clinical, when you take the history, this is called the data, subjective or objective data. When you take the data, we have to try to coordinate in between them. If I have a respiratory problem, then cough. So respiratory problem, shortness of breath with cough, this is a connection. I have a respiratory problem. If I have a pitting edema, I mean edema in the leg, same time jaundice, maybe liver problem. So what are the sign and symptom you have to take from the patient? Then you have to coordinate, right? So who can coordinate? You or healthcare provider, because you have enough knowledge, and this knowledge you got from anatomy and physiology from your school. So this is the knowledge help you to understand all of the materials, and also the laboratory. When you go and write the laboratory test, when you get it, you have to interpret what are the normal and what are the abnormal findings. So laboratory data and diagnosis help you to nursing diagnosis. And definitely according to your patient, and either you should work in somewhat supervision or someone work under your supervision, right? So to check all of the vital sign, we have to delegate the patient. So delegate the co-worker or nursing patient, nursing staff who take for which patient. So also people's and place, it is also important correlation with the patient. If patient need, we have to educate them. We have to tell what is your diagnosis, what are the treatment option, okay, which one you prefer. After the treatment, we go for the intervention. After intervention, we have to wait for the outcome. Patient is improving or patient condition going to down. If patient condition going to down, we have to change the treatment option. Means we have to think and conference. It's called the post conference for patient outcome or improving. Now they're talking the information of the systemic feature, why the particular safety measure is most important. Safety measure is important to stop the spread of infection, easy way. What could happen if those safety guidelines are not allowed? It means the infection should be spread out, be like a pandemic, like what we are facing right now, COVID-19, right? Pandemic would be. So it is very important. We should measure the safety feature, and also we have to break down the chain of infection and stop the infection. And finally, the information in the skill procedure. Review the steps of each of the skill procedure. Make sure you understand what are the steps are important, and also what could happen if each of steps are not allowing or followed out of the order. So definitely we have to, every time we have to go and think this systemic way. We have to measure the skill, or we have to go through the, I mean, organized way basically. And we have to go also follow the step-by-step process. So this is for today.